Hi. So if you ever had an issue diagnosing a brainstem lesion either in real life or in your exams, there's a 2005 article by Dr. Peter Gates, which is called the Rule of Four, and it makes your life very simple. I further simplified it after reading the article. So there are two steps in diagnosing a brainstem lesion. The first step is to know whether a brainstem lesion is medial or lateral. So there are four medial structures which all start from M. First is the motor pathway. The second is the medial lemniscus. The third is the medial longitudinal fasciculus. The fourth is the motor nuclei of four cranial nerves, which are 3, 4, 6, and 12. And if you want to remember, there is a trick that they all divide 12. And now there are four lateral structures as well, and they all start with the letter S. So there is spinocerebellar pathway, there is spinothalamic pathway, and there is the sensory nuclei of the fifth cranial nerve, which extends from the pons to the medulla. And then there is sympathetic pathways, involvement of which will lead to Horner syndrome. So depending upon which symptoms the patient presents with, you can diagnose it as involvement of these structures and can diagnose whether it's a medial brainstem lesion or a lateral brainstem lesion. Now, once you have diagnosed that, you need to know where the lesion lies. So that is the step 2. So there are four nerves in the medulla, which are 9, 10, 11, and 12. Four in the pons, which are 5, 6, 7, and 8. And four above pons, 3 and 4 in the midbrain, 1 and 2 not in the midbrain. So involvement of any of these cranial nerves will tell you where exactly the lesion lies, either in the medulla, pons, or above the pons, either in the midbrain or above it. So now in the exam, you can do it two ways. If somebody asks you what is a medial medullary syndrome, you know that medially the structures are motor pathways, involvement of which will lead to contralateral hemiparesis of the arm and leg, and also medial lemniscus, which, if involves, leads to loss of vibration and proprioception in the contralateral arm and leg. And if I add a medial medullary nerve here, so you know the nerves in the medulla are 9, 10, 11, and 12, but the medial nerves are only 3, 4, 6, and 12. So it's the 12th nerve. If I add the weakness of the tongue on the ipsilateral side, you know this is a medial medullary syndrome, also called as Dejerine syndrome. Or if I give you an example, like if a patient has presented with contralateral weakness of arm and leg and contralateral loss of vibration and proprioception, ipsilateral tongue weakness, you can place this in the medial medulla, and you can diagnose a medial medullary syndrome that way. I hope it helps. Keep learning. Follow me for more such video, and comment notes and follow if you want these notes in your DMs.